You can wave Akisu, Bataba, and Dr. Atafena Abalo. There's Akizu and Ata. If you can switch on, there's Ata, both based in Togo. And Akisu and Ata will also help with the translation support if needed in the breakout rooms. We do have interpretation available. If you look at your dashboard at the bottom, there is a globe with interpretation, and you can click on that and put French or English. So thank you so much. Let me go briefly through the program. We have in the room, yesterday we had 103 participants registered. In the room we had about 91. Today we are on 48, but we hope that more people will join. We have a diverse range of organizations present. And of course, research universities and CG institutes are well represented, and national research organizations. And we also have involvement of development partners, government, international organizations, private sector, and civil society. You can see in the column on the right that of the 16 countries that are the focus of this One Health Challenge, Nigeria and Benin and Ghana are well represented, and we are happy to have the other countries on board, and we hope that as the stakeholder process continues that more countries will join. And we have people from all continents of the globe. So we have people from Europe, from the North and South America and Asia. So welcome for your interest. The time zones are not very convenient for you, so we really appreciate to have you on board. Just briefly to go to the workshop objectives. We are hoping to articulate a shared vision, outcomes and outputs. Yesterday we looked at the vision and what it would look like in 2030 when the One Health Challenge has hopefully achieved its goal. We also want to forge partnerships to advance an innovative R4D, research for development agenda. And today we will look into next steps to operationalize this initiative in 16 countries and the region. So briefly, the program for today. Yesterday we had opening remarks by the Director General of IITA, the Honorable Minister of Agriculture, Livestock and Fisheries of Benin. We also had an introduction on the 2-degree initiative and the Global Commission on Adaptation. We had a presentation on the One Health Grand Challenge and findings from the stakeholder survey. We then had inputs from FARA and CORAF, and we looked then at whether the vision was aligned with and the strategic priorities were aligned with the different countries. Next slide. And today, and we then had, we reviewed all 4 strategic priorities, and we will have a recap. Today, we are going to have a presentation from the breakout groups in more detail, and we will then develop an intervention logic per strategic priority. We will then have feedback and a synthesis of findings, and we will have some statements of support from various stakeholders, and we will then go into the way forward with next steps presented by Bruce Campbell on the 2DI Global and the next steps for the One Health Challenge initiative. And we will close exactly at 3:30 West Africa time. So having said all this, I would like to hand over to Dr. Tepayoto from the IITA.
As I'm trying to share my screen, can you see my screen, please? Do you see my screen, please?
Yes,
Okay,
perfect.
excellent. So thank you everybody for joining. Yesterday has been a truly excited day, and we really appreciate you coming from all over the places to really um, um, join forces and make your contributions for the development of the One Health platform for climate-driven pests and diseases in West and Central Africa. So yesterday there have been quite interesting sessions from the opening to the scene setting and then breakout groups. So I will present this recap together with my colleague Malik Ba. And during the opening session, we had the Director General of ITA, Dr. Sanginga, who believes that the One Health platform is really a true opportunity to leverage BMAP's multi-stakeholder platform, which has established partnerships involving not only researchers, but also the civil society, farming communities, non-government organizations, and public and private structures to tackle the
This
adverse
meeting is being recorded.
effects of climate-driven biotics. And he concluded with a hope that we will come together and develop the One Health platform in a truly holistic way and collaborative spirit for the benefit of both present and future generations. And during the opening session, we also had the privilege of hearing from the Minister of Agriculture, Livestock and Fisheries of Benin, His Excellency Gaston Dossoui, who expressed clearly that the One Health Grand Challenge aligns perfectly with Benin government action plan and ambition to launch an international research center for climate resilient agriculture, the CIRAC initiative, which was championed by His Excellency Patrice Talon, President of Benin Republic, and that was at Marrakech COP22. And he really confirmed that the beauty of the One Health Grand Challenge is about decision makers' engagement, fostering cross-governmental collaboration, inclusiveness, and enhance synergies. And he concluded that he looks very much forward that the One Health will really mobilize existing expertise and resources to advance, the agenda for climate resilience in the agricultural sector in the region. And then comes the scene setting with some of the key take-home messages from Christina, who was representing the Global Commission on Adaptation. And also we heard from Maiguri, who is a research professor at the Norwegian Institute of Bioeconomy Research. So Christina says, in line with the 2-degree initiative, that we need to transform ourselves. We are currently fragmented, inefficient, lot of duplications, supply-based, siloed, and we need to transform that. We need to reverse the situation. And that's the reasons why the CGIAR is putting together a unique 2-degree initiative, not to do the research for developed business as usual. And climate change will be at the center of the future research strategy of the CGIAR. And then, interestingly, we have um, strong support from the Global Commission on Adaptation to really take forward the CGIAR's next generation research agenda on climate resilient agriculture by mobilizing funding commitments up to 650 million US dollars. And that was announced last year, September 2019. And they will be also helping in putting together critical findings during stakeholder consultations of the 2DD initiative and present them to founders and policymakers at the next Climate Adaptation Summit in January 2021. And then comes Maiguri presentation with the best definition of the One Health concept that we can have: collaborative, multisectoral, transdisciplinary, with the ultimate goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. And of course, we all know that climate change will disrupt complex interactions and trade-offs between different ecosystems with huge adverse economic implications. And the One Health Grand Challenge comes timely, really, and is designed to provide support to agricultural producers' management of biorisks, plus government approaches to address climate-driven food health risks, institutionalized capabilities for early detection of emerging threats and rapid response, and then new technologies for biocontrol and other nature-based solutions to pest management. And she finished her presentation by looking very much forward that we will build from kickoff webinar deliberations to further develop the strategic priorities of the One Health platform. And then from the regional perspective, we heard from Koraf, represented by Usman, and Farah, represented by Wole. So Koraf is currently leading the Zira-funded biorisks projects for sound management of key biotic stresses, including cassava mosaic disease, cassava brown stake disease, and fall armyworm in the face of climate change. And the project, the biorisks project, works closely with the West African virus epidemiology, the WAVE group, and intends to support the biorisks management facility, BMAF, hosted by ITA, for a better coordinated mechanism of biorisks management in the region. And this indeed has truly leveraging potential for the One Health Grand Challenge. And we believe the collaboration between CORAF and the CGIAR's biorisks management hosted by, biorisks management facility, BMAF, hosted by ITA, will be a unique benefit for stakeholders and for smallholder farmers in the region. And then Farah is confirming that the One Health platform provides smart instruments for gathering and developing technologies, provides opportunities for foresight, scenario planning, and risk aversion, and aligns with continental frameworks. So Wallace said that the One Health platform is a true opportunity for demand-driven, inclusive, and holistic strategy, building upon successful models and taking suitable climate-smart technologies to scale. And finally, he assured that the One Health platform is an opportunity for synergies with further interventions for agricultural transformation and wealth creation in the region. So that was happening during the opening and scene setting sessions. And we also had breakout discussions, and I will hand over to my colleague Malik Ba, who is representing ICRISAT and is the country rep of ICRISAT in Niger. And it's also my pleasure to remind that ICRISAT is one of the co-organizers of this consultation. So I will stop sharing my screen and hand over to Malik for his presentation. What was the key findings during the breakout discussion? Please, Malik, over to you.
Thank you, Tepa. So Rebecca is sharing the screen. Okay, thank you, Rebecca. So I would like first to thank all the facilitators and rapporteur for the excellent work. And special thanks to Manu Tamo who put this together. So, and as yesterday we had the breakout groups and where all the different groups discussed these different strategic priorities. And regarding the first strategic priorities on horizon scanning and early warning system, it appeared that this one is well aligned to most of the countries' own strategies, and in some countries it is even coming as at the top of the priorities. And some countries also specify that they already have a system for a kind of alert system through social media or through the different ministry in charge of the development sector. We got animal and human health, for instance, for Burkina Faso and Ghana. And countries like Niger and Senegal pointed out the case of the early warning system for the desert locusts. So in terms of knowledge and capacity gaps, the different countries mentioned the need to have a kind of one-stop shop platform where data could be made available, and especially the benchmark data for climate change effects that are missing. And they also mentioned the need for capacity development for deployment of novel tools and also rapid diagnostic of the problems. They also mentioned the need to being capacitated in pest risk analysis and pest risk modeling, and also a need of having a fast tracking funding system for rapid response in case of outbreak of any pests. And the partnership has also come very strongly, and they emphasize the need of having a institutionalized no, they mentioned that there is already existing partnership in the different sectors in the different countries, which need to be reinforced, of course. And they also mentioned the innovative public-private partnership for delivering on One Health, and also the pooling of resources for rapid molecular diagnostic that is missing for the different countries. Next slide, please, Rebecca. Next slide, Rebecca. So then regarding the second priority on climate risk, on managing climate-driven biorisk, that one also is well aligned to the different countries, and some countries say that is coming at the second level in terms of priority. Some others are also saying that the third priority. And in terms of ranking, the plant health is coming first, followed by animal health, water health, and then soil health. And for capacity building and knowledge and capacity building, so they mention the need of ICT tools for digital identification of soil nutrient management. We also mentioned the need to empower the farmers in the different countries for them to have an informed decision on the biorisk. And they also mentioned they need to have at the regional level, a lab where biopesticide can be certified, because all the countries mentioned they need to go for biopesticides, but we don't have a kind of standardized way of producing it in the country, in the different countries, and then a lab is needed in the region to help them doing that. Partnership is also mentioned as something that is already existing, which need to be reinforced for effective response. And they also mentioned the need to establish a virtual platform for training on biorisk management in the different academic institutions. Next slide, please. So regarding the third strategic priority, which is on harnessing high throughput technologies for food safety, that one also has been mentioned as a priority that is well aligned to the countries. And countries like Nigeria even say that is coming at the top of their priority, and Ghana, second priority. So other countries also mention it, but we are just referring to those who specify at which level do I rank it. So in terms of knowledge and capacity gaps, there is a limited knowledge on food safety standard, and they also need a training on water health management, especially the waste water, and also need some training on policies and awareness on eco-solution approaches for controlling pests and diseases. And in terms of partnership, it is there, but it needs to be reinforced and also to involve all the specialists in the chain. Next one, please. So then the last strategic priority was on the mainstreaming of biorisk management into the national and regional development program. That one also is well aligned to the country's priority. And some countries like Benin and Niger mention that they already have enabling policies that facilitate the importation and promote the use of biopesticide. I remember also that Senegal, for instance, said that there is also kind of NGOs in the country that are lobbying for the use of biopesticide, agroecological approaches or in all the farming practices. And Ghana also mentioned that there is already a One Health policy document that is being developed. So it's a draft document that is being developed, so which means that we are quite advanced as compared to other countries. So for the knowledge and capacity gaps, there is a need for proactive containment plans for pests that are not yet in the different countries, but which are likely to come one day. So there is also a need to reinforce the linkage between the actors in the sector, the research, extension, and farming interface, because knowledge sometimes is there, but it's not it's not available. The access to knowledge is not that much easy for the end users. So then regarding the partnership, innovative partnership involving farmers, organization, government agency, and civil society is needed. And also a platform for identification of suitable partner to be contracted for specific biorisk is needed for the region. So I stop here and thank you very much. Over to you, Depa.
Thank you very much, Malik, for excellent synthesis of the breakout discussions. If in the audience there is any burning comments, please feel free to raise your hands and comment. Otherwise, you are also invited to put your comments in the chat. So I'm not seeing anyone coming. So thank you very much for listening. Over to you, Mo. Mo, you are muted.
Yeah, if you want to raise your hand, you can click on participants at the bottom of your dashboard, and then you can, there's a button that says raise hand. Okay, great. Are there any questions? I think there's a lot of information, wonderful recap. Thank you so much, Dr. Tepa and Dr. Malik. I'm sure that that there will be some comments or questions. We really invite you to contribute. Okay. I would like to invite Dr. Brock Bertram, Chief Scientist from USAID, to address the session.
Thank you, Mo. Sorry, I was having a bit of difficulty getting off mute. Well, I apologize for going out of order today. It's the World Food Prize this week, and later when I was slated to say something. My comments will just be brief, and I appreciate the catch up this morning that we just heard, and I'm glad to see the holistic approach that's being described here in terms of things like plant health and environmental health. Having said that, I can tell you that from the USAID side, the great focus is, of course, on the potential effects on human health. So it's been many years, really since the avian influenza outbreak, that we've been a major funder of this area. We have a whole team on emerging pandemic threats, and also work on antimicrobial resistance. And just recently now, we've awarded a $100 million grant to Tufts University. It's called Stop Spillover. I guess I have a few comments from colleagues I spoke to yesterday that I would briefly share. And one is that while the early detection is important, it's really a layered approach that's needed. And this is, I'm talking especially here about the potential for pathogenic outbreaks from probably animal systems, but integrated systems as well. And I think the idea is to do a better job of reducing emergence. The detection and fast acting is got to be there, but it's also limited, we think in potential in terms of really stopping these things, because once they get started, they really go quickly. So it's this idea that, especially in sub-Saharan Africa, where you have very rapidly transforming food systems, we need to think about ways to head off the risks. And the good news is that my animal science colleagues tell me that this will be more readily, it can be done in ways that are cheaper and actually, increase efficiency, reduce risks that are also good for producers. So you need a strong stakeholder engagement, private sector engagement, and I think you're working at that here. And with the idea perhaps of getting to specialized risk assessments, sort of the way we do environmental assessments routinely, could this be integrated in a way that would inform risk mitigation? And then I think very importantly for today's discussion, what is the global public goods research agenda around that? And I think there probably is one. And I actually think the timing, of course, that you've chosen for this meeting is very good. There's just going to be a lot of interest in trying to prevent what's going on in the world right now from happening again. Um, it's basically biosecurity, good production, marketing, market infrastructure, all those kinds of best practices. But I think especially understanding how those kinds of things can be layered would be an interesting area to think about. I think the thing that I have to just admit is that the climate change dimension of this, while certainly important, is one that I haven't focused on as much directly. So I'm pleased that the group here is really thinking about that, because I'm sure there are many impacts there that we should be thinking about. And finally, we are in the CGIAR system, and I represent USAID in that system, working with our center colleagues like IITA, with the CRP, the programs like CCAFs, and all the other centers. And I think we do need a sort of a clear approach at the level of the CG system on One Health too. And that doesn't preclude the regional efforts that are going on. We do need to be involved in other things like the 2-degree initiative. But I would also encourage my great friend, Dr. Sanginga and Maiguri, and to help institutionalize this message in the evolving One CGIAR. So thank you very much for letting me join you early. I will stay on for as long as I can. And thanks again, and good luck with the rest of your discussions. It's great to see a lot of faces I know well. So nice to be here.
Great. Thank you so much for your statement of support. We really appreciate that. And I think we have great input now to set the scene for the rest of today's session. There are a few points that are coming through on the chat, and I invite you to please continue sharing your thoughts. Maybe we can ask to a response on some of the points. There is a question about the second priority, that human health doesn't really, it's not really forefronted. It's sort of doesn't even come in fourth priority. And then add an aspect on soil management in the section of knowledge gap. So there's a specific suggestion there. I think these are really good suggestions that we can take into the breakout rooms, perhaps. Dr. Tippa, I'm just looking at you if you want to engage with those 2 points.
Yes, I think there is a question regarding the mainstreaming of human health element. And I think what we do, we work closely with ECOWAS One Health initiative. And in this group, there is the West African Health Organization taking care of human health. So of course, we cannot cover all the elements. That's why we are working with, other centers and initiative to truly make it holistic and inclusive. That's what I can say for now.
Right.